Everything about healthcare reform has to be viewed through the prism of how it impacts innovation. Our manufacturers are developing cutting-edge products that are going to treat and cure disease. And we need to ensure that as healthcare reform is implemented, it is done so in a way which does not negatively impact the process of curing disease and treating disease, because when you cure and treat disease, it is ultimately going to save lives and save money over time, and that's a win-win for America.
There are really two issues regarding health reform. One is a sense of uncertainty about what will happen in the current budget negotiations. If in these negotiations over the debt ceiling we see further reductions in Medicare and Medicaid on top of what was included in health reform, that was unanticipated in our support for health reform and could cause problems with implementation. Second, there are obstacles to implementation both in the court's consideration of the individual mandate, one of the keystones of health reforms, insurance reforms, and Republican opposition to health reform, period, which, if the president's not reelected, could lead to the entire structure being changed. So that uncertainty makes implementation difficult to deal with at best. Second is this issue of delivery reform. I'm not sure that necessarily accountable care organizations are going to proliferate, but what's really important is that for hospitals, value-based purchasing, penalties for readmissions, and penalties for hospital-acquired conditions, and other parts of this legislation that will go into effect, that will affect care, are going to affect the way that hospitals look at the delivery of care pre- and post-hospitalization, as well as in the hospital itself. And that's going to change how we integrate and coordinate the care that Medicare beneficiaries and Medicaid recipients receive.
Well, this is a really exciting time to be involved in healthcare, and it's a really nerve-wracking time to be in healthcare because a lot's going to change. The country's trying to grapple with some really important issues. And what medical device companies want to keep at the forefront when we talk about healthcare reform is what's the outcome for patients? What's going to happen if you can't get the most innovative technology in order to cure your problem or condition, whether that's a new hip that's going to last longer, or whether it's the new transcatheter heart valve that's going to make it possible for you to get heart valve surgery. We're very concerned that everybody's going to focus on an overall number and not on what's most important for the patient.
This afternoon I wanted to make 3 points. First is states are facing an enormous number of simultaneous challenges to implement health reform because it changes so many pieces so fundamentally. Second, I worry very much about the timelines. It is an extraordinary challenge to try to implement the Medicaid expansions and all the insurance reforms and the creation of the exchanges in the time that's available. And lastly, we're in the midst of an enormous fiscal crisis, which means that resources are extremely constrained, and it's just unclear how people will afford, states in particular, will afford what's required.
Well, in talking with our readers, the CEO of provider organizations, there's lots of issues that keep them up at night. But some of the issues that surface to the top are financial challenges, particularly pressures on operational costs, which is reform's biggest challenge, physician alignment. It is very challenging for them in terms of patient safety and quality, which remain as high a priority for providers as ever. Reform implementation and meeting governmental mandates are some of the key issues that keep our readers up at night.